Have you ever noticed how one little thought, like, I'm going to totally mess this up, can, like, snowball into this huge wave of, like, bad feelings?
Yeah.
Your heart starts pounding, you get all clammy, and then boom,
Yeah.
you actually do mess things up. So our minds can actually, I don't know, change what happens.
It's true. Our thoughts have this incredible power over our feelings and actions. And that's actually where cognitive behavioral therapy comes in, or CBT as it's more commonly known.
Right, CBT. So you've sent us a ton of info on CBT.
Right.
We're doing a deep dive into what makes it more than just another therapy buzzword. So what is it about CBT that makes it such a popular approach?
Well, I think one reason is that it's very practical. CBT provides very practical tools to actually you work with those thoughts rather than just letting them kind of rule us, right? It's a structured, very goal-oriented therapy that helps you identify and then challenge unhelpful thinking patterns.
Okay.
Think of it like you're learning this new set of mental skills that you can then take out and use to navigate all of life's challenges, from everyday stress to more, I don't know, more serious things like addiction.
So not just thinking differently, but because you're thinking differently, you're acting differently.
Yeah, exactly.
It's interesting you mentioned addiction because we often think of addiction as, very physical dependence.
Uh-huh.
But in our research, there's obviously a very strong mental component as well. So is that where CBT steps in for addiction treatment?
Yeah, you're hitting a really, really crucial point because addiction is a lot more complex than just physical reliance, right?
Right.
And so what CBT does, it helps people who are struggling with addiction to identify those negative thought patterns and triggers that often, contribute to kind of fuel their addictive behaviors.
So instead of just addressing the substance use itself, you're going to the why behind it, right?
Exactly.
That makes a lot of sense. So let's say they reach for a drink when they're feeling stressed, which a lot of people do.
Right.
How would CBT help them kind of break that cycle?
Okay, well, in that scenario, CBT would first help them recognize that connection, like you said, between the stress and the drinking. And then what they would do is they would equip that person with healthier coping mechanisms to basically use instead of alcohol. So maybe it's learning to manage that stress through exercise or mindfulness, or even something like reaching out to a supportive friend instead of reaching for a drink.
It's about giving them a new set of tools to manage.
Yeah.
Those are like really, really difficult situations. And then ultimately, they can make healthier choices.
It's exact.
This reminds me, we came across a term in our research, cognitive restructuring.
Yes.
And that seems to play a big part in this.
It's absolutely essential.
Okay.
Cognitive restructuring is one of the core techniques used in CBT, and it's especially helpful, like we were just talking about, in addressing addiction. Essentially, it's about learning to challenge and then reframe those automatic negative thoughts that can often lead to those unhealthy behaviors.
Okay. So we've tossed around cognitive restructuring a couple of times.
Right.
What does that actually look like in practice? Can you walk us through that?
Yeah, so let's just imagine someone who's struggling with addiction, and they have this thought, I'm a complete failure. I'll never overcome this.
Okay.
So with cognitive restructuring, they would learn to question that thought.
So instead of just accepting that as truth,
Right.
they're encouraged to challenge it.
Exactly. What a CBT therapist might ask is, what evidence do you have to support that thought? Is there a different way, another way to look at this situation? And they might even help the individual reframe that thought to something like, okay, so I'm struggling right now, but I'm committed to my recovery and I'm not giving up.
So instead of saying I'm a failure, which feels very finite,
Right.
it's I'm struggling right now, which feels a lot more hopeful and less overwhelming. It's like you're reframing it to be more constructive instead of destructive.
Exactly. It's like recognizing those thoughts are just thoughts. They're not necessarily facts. And with practice, people can learn to identify and reframe those negative thought patterns, which can then lead to more positive emotions and then, of course, healthier behaviors.
Yeah. This is fascinating to me, this idea of rewiring those automatic responses that we have. Are there other CBT techniques besides cognitive restructuring that can help with this?
Absolutely. Another really powerful technique is exposure therapy. And this is especially helpful for those who struggle with anxiety or maybe even phobias that might be feeding into their addiction.
So if someone's using substances to cope with social anxiety.
Yeah, Yeah,
That's a good
exactly.
example.
That's a great example. So with exposure therapy, they'd gradually and safely expose themselves to those social situations while also using their newly acquired, CBT coping skills to kind of manage their anxiety.
Okay.
And over time, this helps to, one, reduce their fear, and two, it helps them avoid having to rely on those substances as a crutch.
So they're facing their fear head on, but in a controlled environment.
Right.
So it's like, dip your toe in the water before you like jump into the deep end,
Yeah,
right?
exactly.
It allows them to build their confidence and build their tolerance. What other tools are in this CBT toolkit?
Well, another thing that CBT therapists will do is they often give what they call behavioral assignments, which is a fancy way of saying homework,
Yeah.
right?
Homework for your brain.
Exactly. So it could be something as simple as, practicing relaxation techniques like deep breathing, or even just making it a point to engage in enjoyable activities that boost your mood.
So it's creating healthy habits to replace unhealthy habits.
Yes, exactly.
Does the research actually support that CBT helps with addiction? Because this all sounds very promising, but I imagine some people listening are like, but does this really work?
It's a valid question, and the good news is that there's actually a lot of research that supports the effectiveness of CBT for addiction. For instance, studies have shown that CBT can lead to some pretty significant reductions in substance use, fewer days of drinking, and even improvements in overall mental health.
Okay.
In fact, one study actually found that 60% of patients who underwent CBT for substance abuse, they provided clean toxicology screens after a year.
60%? That's significant.
That's huge. It's really encouraging.
Yeah.
But it's also important to remember that CBT isn't a magic bullet.
Right.
Like any therapy, it does require a certain level of commitment and really active participation from the individual.
So it's not just showing up to therapy and expecting these results. It's you're putting in the work during the session, and then you're taking those tools and you're applying them to your everyday life to really make those changes last.
Exactly. And that's where, the support of a trained therapist is really, really crucial because they provide guidance, support, and accountability along the way.
So it's about having that, that person there, that guide to keep you going, especially when it gets tough,
Yeah.
which it always does, right? I mean, life
Wow.
life throws curveballs even when you're not battling addiction.
Right.
And speaking of which, we keep coming back to addiction, but this deep dive into CBT, I mean, this is really for anyone who is looking to understand this therapy a little bit better.
Absolutely. CBT can be helpful for such a wide range of challenges, like from managing, like you said, stress and anxiety to coping with things like depression or even relationship issues.
Okay.
It's really about giving people those valuable mental tools to navigate just the ups and downs of life, whatever those look like for them.
It's like learning a new set of skills that you can apply to so many different areas,
Exactly.
which makes me think about the practicality of CBT.
Yeah.
Because it's often considered a relatively short-term therapy compared to some others.
That's a big part of the appeal for a lot of people.
Right.
And so while the exact length of treatment, that always varies.
Right. It's going to be different for everybody.
That depending on the person and what's going on and how complex their challenges are.
Of course.
But CBT generally focuses on achieving very specific goals within, a certain time frame.
So rather than years on the therapist's couch,
Right.
it's more about, okay, let's learn these very kind of targeted skills, these strategies
Yeah.
that you can then take with you after therapy ends
Exactly. Precisely.
and continue to use them.
It's like you become, your own therapist, so to speak.
Become your own therapist.
Yeah.
I like that.
But, it's also important to acknowledge that CBT isn't a one-size-fits-all solution.
Right. There's no magic wand with mental health, unfortunately.
Exactly.
Are there certain people or situations where CBT might not be the best fit?
While CBT is generally considered safe and effective for most people, there are some exceptions.
Sure.
For example, people who have more severe mental health conditions like schizophrenia or bipolar disorder, they might need different approaches in addition to or even instead of CBT.
So it's really important to have that open conversation
Yes.
with a qualified mental health professional
Absolutely.
to figure out what that best course of treatment is.
Yes, 100%.
And that might include CBT in conjunction with, like you said, other therapies or medications.
Exactly. And it's also important to remember that CBT does require a certain level of, commitment and active participation if you really want to see results. It's not passive. You don't just show up and, receive advice.
Right, you have to do the work.
Yeah, you have to be engaged in those exercises and really be practicing those skills.
Yeah.
both inside and outside of those therapy sessions.
That's where the real growth happens.
That's where the real growth and change happen. But for those who are willing to put in the effort, it can be incredibly empowering and effective in helping them just create these lasting positive changes.
It has been fascinating diving into the world of CBT with you today.
Yeah, it's been fun.
We've covered a lot, from the core principles and techniques to its effectiveness in addressing addiction, other things as well.
Right.
As we wrap up, what's the one key takeaway that you want our listeners to walk away with today?
If there's just one thing I want you to remember, it's that you don't have to be a prisoner of your own thoughts.
Oh.
CBT provides these really practical, evidence-based tools to help you understand those thoughts, challenge those thoughts, and ultimately change how you respond to them.
It's about taking control of your mental well-being.
Yes.
And creating a more positive and fulfilling life.
Exactly.
And if this deep dive has sparked your curiosity, take it a step further. Explore it a little bit more. We've included some great resources in our show notes where you can learn more about CBT. You can find qualified therapists in your area. You can even try out some free online CBT exercises.
Awesome.
Until next time, keep those minds curious and remember, your mental health matters.